We're live now. We can.
Good evening to all. The National Vaccination Day, also called the National Immunization Day, is celebrated every year on March 16th to convey the importance of vaccination to the entire nation. The day was first observed in the year 1995, the year on which India started Pulse Polio program. This year, the National Vaccination Day is important as the country has started its biggest COVID-19 immunization program early this year and has already crossed the 30 million mark. On this day, Institute for Ancient Research and Publication and Society for Nursing Practices is glad to conduct this webinar on National Vaccination Day and its significance by Dr. Dinesh Selvam Sir, Principal and Professor, Sarvodaya College of Nursing, Bangalore. Institute for Engineering Research and Publication is one of the world's largest non-profitable professional association meant for research development and promotion in the field of engineering and technology. We are a platform to promote the advancement and dissemination of the knowledge of engineering and technology. IFERP is a professional association and a forum where innovations and research interests could be supported and developed, prioritizing our mutual interest. Our forums and associates constitute professional leaders and organizations connecting each other with mission to work as wizards of science for defending the earth. And Society for Nursing Practices is a professional association caring for people. SFNP is a non-profitable professional association meant for development in the field of nursing science and healthcare. SFNP is an international forum for nurses for sharing knowledge and innovation in the field of nursing science and healthcare. SFNP aims to bring together nurses to encourage intellectual development and providing opportunities for developing and collaborations. Now I would like to introduce our speaker, Dr. Dinesh Selvam, before the talk. Dr. Dinesh Selvam is principal at Sarvodaya College of Nursing and also professor and HOD in Community Health Nursing and PhD guide in PhD Consortium, Indian Nursing Council and Rajiv Gandhi University of Health Sciences. He has obtained PhD in Public Health Nursing from the Tamil Nadu Dr. MGR Medical University in 2015. He is having 22 years of experience in nursing service, education and research. Dr. Dinesh has published around 15 papers in national and international journals. He has served as resource person and guest speaker for more than 40 international and national conferences and presented around 30 scientific papers. He also served as member secretary, Ethics Committee, ICMR approved Madras Diabetes Research Foundation. He is the editor-in-chief of Journal of Nursing Practice and Research. He has received many notable awards and recent ones are Global Excellence Award for Distinguished Service in Nursing Education and Inspiring Educators 2021 Award. Dinesh sir, now I welcome you to provide the keynote address. So I guess you are not audible, you're muted.
Sorry. Thank you. That was a warm welcome from Ms. Pooja. And Pooja, will you let me to share my screen?
Sure, sir, please.
Yeah. Is my screen visible?
Yes, sir. Please proceed.
Yeah. Good evening to everyone. And on this day, the National Vaccination Day, and its significance is going to be a special talk on this importance of National Vaccination Day. And at this juncture, I want to express my thanks and acknowledgement to the entire staff and the managing director especially, and the entire staff and the team of IFERP and SFNP, the Society for Nursing Practices, and Technorate Group for giving me an opportunity to address the audience on this event of National Vaccination Day. Yeah. Going to our presentation, National Vaccination Day is celebrated in March 16th every year, and actually it emphasizes the significance of the vaccination and its effect on the public health. And especially this vaccination day is to promote awareness to all the public and to the health workers, their contribution, and mainly to acknowledge the vaccinators and to make the public to utilize the services of the vaccination to make them free from the diseases. And as per World Health Organization, immunization is the most significant tool for eradication of all life-threatening infectious diseases. And this year, the National Vaccination Day theme is said to be Vaccines Work for All. So it means that the theme highlights how vaccines work for all and how it saves the lives of all around in the world. We have a quite history for this National Vaccination Day. It was first in India celebrated on March 16th in 1995, because it was on this day that our first oral dose of polio vaccine was started in the country. You all know about the Pulse Polio program, which was a very huge success. And indeed, it was in 2014 that India was announced as a polio-free country by World Health Organization, and the entire credit goes to the Pulse Polio program. It was a massive achievement in the history of India. Yeah, what is vaccination? What do you mean by vaccination? It refers to the act of getting a vaccine. But then what is immunization? Immunization means you are getting being immune against a particular disease by being vaccinated. So vaccination is just an act, and immunization is that you get immune after vaccination. This vaccination is a simple, safe, and effective way of protecting people against harmful diseases before they come into contact with them. So it is the body's natural defenses to build resistance to specific infections and make the immune system very stronger. So vaccines train the immune system to create antibodies just as it does when it is exposed to the disease. However, the vaccines will contain killed or weakened forms of germs like virus or bacteria, and they do not cause the disease or put you at risk or complications. And what is the importance of vaccination? Vaccination helps in preventing the spread of disease, and it makes the people immunized against particular diseases. And it is entirely safe and effective, and they help your body fight against bacteria and germs. And in the long term, vaccines do not have any side effects of the body, but though it depends from person to person and their natural immune system. And few side effects will be there at the time of vaccination, that may be the redness on the place where the person is injected, or a mild fever or pain in hand. But this side effects are not going to continue. Only this is due to the injection site and at that area. And this also depends upon the immune system of the patient. Yeah, vaccines are very special. You know, every year vaccines prevent around 2 to 3 million deaths every year. And additional of 1.5 million deaths could be avoided if vaccination is given thoroughly every year. And vaccines promote health. Unlike other interventions, you know, this is the primary prevention, where it makes the people to remain healthy and to remove any infectious diseases attacking them. And vaccines have a very expansive reach. You know, they can protect individual, community, and the entire population. Vaccines have a large and a rapid impact, and the impact on the communities and populations is almost immediate. You know, in 2000 and 2017, vaccination reduced the global death that was coming out of measles by 80% worldwide. And vaccine saves lives and also the cost. And this includes the medical cost and the productivity loss that is going to happen because of these diseases. What is in vaccine? Yeah, vaccine have water, the main ingredient, and it has the preservatives and stabilizers, which will maintain the vaccine quality and to save the storage and prevent contamination. It has an active ingredient where a very small amount of harmless form of bacteria or virus that is going to give you that immunity is there. And you have adjuvant. These adjuvants, you create a stronger immune response to the vaccine, and you do have in a vaccine residual traces or substances that is being used during vaccine manufacture, so that it measures in the final vaccination. Example, formaldehyde, which is naturally found in the human body. So these are the ingredients you can say that one vaccine has in it. How does it work? How vaccine work to produce immunity? It works in two ways. One, it may be via natural infection and vaccination. How do you get immunity? So immunization, that is going to trigger an immune system response by which the vaccine will develop a long-term protection immunity and apart from naturally occurring infections. How do these vaccines work? Yeah, when small amount of harmless form of disease which is being produced in the body, then the body is going to make antibodies which is going to fight against it. And then if the person is going to encounter with the disease, the body already has the antibodies so that it fight against it and it doesn't cause you sick. So this is where you call that you are immune to vaccines. There are notable vaccine preventable diseases. This vaccination for various diseases are given. What are those diseases? You have vaccination for BCG, which you call it as Bacillus calmette-guerin, named upon the discoverer's name. And it is going to be against the disease tuberculosis. And you have diphtheria, pertussis, tetanus, toxoid, together called as DPT vaccine, which is against diphtheria, pertussis, and tetanus. You have oral polio vaccine against polio. You have measles vaccine against measles, hepatitis B vaccine against hepatitis B, and you have tetanus toxoid against tetanus. You have Japanese encephalitis vaccination. This is given only in the districts where the disease burden is more. And you have H1B containing pentavalent vaccine. So this pentavalent vaccine is also being introduced recently, and it is being given in some of the districts under pilot study. This vaccines, you have different types. In one type of vaccine, you have the weakened version that they produce inside the body. And in one more type, you have the inactivated form of a vaccine, which is added with the chemical to produce inside the body to produce the antibodies. And in one part, you have a part of a virus or a bacteria that is being used in the vaccine. And in another type of vaccine, you have the inactivated, the toxin, that is the harmful protein that is made from the bacteria and that is inactivated, added with a chemical, and it is being given. And another type of vaccination is mainly through the genetic code, where they develop mRNA vaccines and DNA vaccines. Yeah, here you can see the different type of vaccines. You have live attenuated vaccine that is given for tuberculosis, oral polio vaccine, measles and rotavirus, yellow fever, varicolosis, and seasonal influenza. And you have inactivated vaccine mainly for polio inactivated and hepatitis A and seasonal influenza. And you have purified antigen type of vaccine mainly for pertussis and Haemophilus influenza type B and pneumococcal virus and hepatitis B and human papilloma virus. You have toxoid forms, which you give it for tetanus toxoid. And you have viral vector vaccine, which you give for Ebola disease. Now, this vaccine manufacturers develop different types of vaccine based on that they are very effective in preventing or reducing the severity of the infectious disease. And the other way, they provide a durable and a long-term protection against the disease. These types of vaccine aims to achieve immunity with a minimal number of doses, and they provide maximum number of antigens that confer the broadest protection against infection. And these types of vaccines may cause a very mild adverse events, and most of the time there may be no adverse events, and they are stable at extremes of storage condition over a prolonged period of time, which helps to maintain the efficacy of the vaccine. And they are available for general use, like for the whole population through mass production. And the types of vaccines are manufactured based on that. They are also affordable to the whole population against the risk for getting infectious disease. These vaccinations are very effective, and this particular slide will show you how effective it is. You can see the diphtheria cases, how much it was cropping up between 1910 to 1940. And after the introduction of this diphtheria vaccine, you can see how the cases were completely eliminated. Same thing for pertussis, and you can see the measles However, 1940 to 1968, it was a big threat, the measles condition. Then after introducing the vaccine, how gradually the measles are contained. So this is how the vaccines are very effective and in reducing the infectious diseases in the population. But there are concerns over the safety, whether how far that the safety of vaccines have been done. So this general public has low tolerance to adverse effects of vaccines, and they are usually given to healthy person. So the healthy person getting the vaccine, and they establish a type of low tolerance to any adverse effect that is going to be happening. And the expectation to safety standard is higher in the vaccines compared to any medicine that sick people will be taking. That should be remembered and educated. And there are national regulatory authorities who conduct a sort of a rigor quality trials and safety and effectiveness of vaccines and all these products being taken care in repeated trials that is being conducted before the vaccines come into the population. And of course, there are going to be some adverse event following immunization, that is following the vaccination, and some untoward medical occurrences may happen, and sometimes it may not happen. Mainly, it depends upon the usage of vaccine and the existing immunity of the person who is getting vaccine. So this adverse event may be unfavorable or unintended sign, so that to produce any kind of symptom or a disease in the community. And this adverse effect may be related due to the product itself or the quality or defect in any kind of vaccine product, or it may be due to the vaccination process, or it may occur even independently apart from vaccination also. So we went through these conditions when you were comparing it with COVID-19, how the population was taking, and they were coming out with many news of adverse effect due to coronavirus and vaccination. And these adverse events may be mainly sometimes due to the route of administration also. So depending upon the route of administration, there may be the adverse reactions happening, and there are limitations depending upon the respective vaccine. So if you take oral polio vaccine, oral route which is given, and you have intramuscular via injections and subcutaneous injections and intradermal injections where some of the vaccines are being used, this injection route of administration also may cause some adverse effects. Right? Impact of vaccines is large based upon the comparing it with the very minor adverse effects that may arise due to the defect or other reasons, as I have mentioned. But the impact of vaccine in the population is very large. You can see health-wise, it has a large impact. Economic-wise, it has a large impact. And social-wise, it has a large impact. When you consider to be a health-wise impact, it reduces the infectious disease morbidity and mortality, and it induces herd immunity. It creates the whole population to get herd immunity against that particular disease. And it prevents any antibiotic resistance in future. It reduces diseases that will complicate vaccine preventable diseases in the community. And also you have an evidence that it prevents some types of cancer if vaccination is being taken properly according to the schedule. And of course, it eradicates a lot of infectious diseases. And economically, it is going to be very cost effective based upon the outbreak of the disease. So the effect it causes cost-wise to the country when the disease outbreak happens is going to be very comparable when you put the cost to the production of vaccine and administration of vaccine to the entire population. And it also gives lots of cost savings and productivity gains for the family and for the production in the particular community and in the country. And this impact of vaccines on society is going to be, it empowers women, it empowers the whole population, and the impact of life expectancy is going to increase, and it gives the equity of healthcare, where equally all healthcare can be distributed at an affordable level to the whole population, And of course, it strengthens the entire healthcare infrastructure. We have, on this vaccination day, we should know what are the various vaccination schemes being adopted by the government. The very successful scheme right now, which is running, is what you call it as Mission Indradhanush program, which was launched in 2014. And under this mission, you can see that the vaccination and the immunization drive was attained to the level of 90% all over India. And there was a quite increase in the immunization coverage. So this graph gives you the improve in the vaccination coverage in India after the intensified Mission Indradhanush. So you can see there was around 18.5% of increase in full immunization coverage after the launch of this particular program, which is very successful. And right now they are with Mission Indradhanush 3.0. And this is the study which came out with what may be the reasons why the people or the general population may miss the vaccination. So one was they were not aware. You can see that awareness gap. You can see that around 45% of the population was saying that awareness gap. So somewhere there is awareness gap, which is the duty of all the health workers right now who are listening this Vaccination Day webinar, to take into count or in mind that to create more awareness to the public and to the population. And the other reason, around 24% of the population quoted that it is fear of adverse events after immunization. That's what you have seen in the previous slides, how the fear of adverse events may be way less against the outbreak impact, isn't it? Right. Then resistance for around 11%, and the child traveling is the reason what they gave for 8%, because they may travel from one place to the other place and they would have missed some of the vaccines during the travel, or they would have not followed up. And operational gap, of course, operational gap may be from the government side or from the health center, from the manufacturer side to the production side, and other reasons. And there were others who contributed around 9% of the reason. So these are the reasons what the public exposed, isn't it, for not using the vaccination or for missing the vaccination. And other main important program which everyone should know by our nation is Universal Immunization Program. So you know, Universal Immunization Program is a very successful and a very large and a mass coverage program, which is the backbone of all this oral polio, hepatitis B and diphtheria and rotavirus vaccine, pentavirus vaccine, and much more. You can see that a successful national immunization schedule, which everyone will be knowing. I'm not going to go in detail about this national immunization schedule, but you can make a note that you have this pneumococcal conjugate vaccine, which is being started administering in selected states and district. We call it as PCV vaccine, and which is given with the pentavalent first dose. And also the vaccine for Japanese encephalitis is being introduced, where Japanese encephalitis is being considered as an endemic in that particular districts. And this is again the detailed vaccination schedule, which is recommended by a Universal Immunization Program for the infants and for the children and for the pregnant women. It's a very successful and the currently running vaccination program under Universal Immunization Program. So some notes on background notes on this immunization or the vaccination is initially the program was called as Expanded Program on Immunization, which was launched in 1978, and it was in 1985 that this EPI was renamed as UIP, that is Universal Immunization Program. And the 1992, the CSSM, we say Child Survival and Safe Motherhood Program. And in 1997, we had this RCH program, all included in this vaccination ambit, we can say. And since the launch of National Rural Health Mission, this Universal Immunization Program became a very integral part of NRHM, we can say. and being very successful. As I already told you, it is one of the very largest public health program, and it target close around 2.67 crore newborns and 2.9 crore pregnant women annually. And it's also one of the very cost-effective public health intervention. And this vaccination under universal immunization program is largely responsible for reduction of vaccine preventable diseases and to reduce the under 5 mortality rate. Under UIP, the government provides a free of cost of around 12 vaccine preventable diseases, as I already noted in the schedule. And nationally, it prevents against 9 diseases free of cost vaccination given to the whole population. That is against 9 diseases: diphtheria, pertussis, tetanus, polio, measles, rubella, severe form of childhood tuberculosis, hepatitis B, meningitis, pneumonia, and subnationally, in the sense where the endemic areas are there, of course, pneumococcal pneumonia, rotavirus, diarrhea, Japanese encephalitis are provided in the places where these diseases are found to be endemic district. And a child is said to be fully immunized if the child receives all due vaccines as per national immunization schedule within first year age of the child. Whatever vaccines the child has to receive, if it receives, then you can say that the child is fully immunized. And the 2 important milestones which we have to mention under this universal immunization program is: 1, elimination of polio, that was in 2014, and maternal and neonatal tetanus elimination in 2015. Mission Indradhanush, launched in 2014, is a very better program which is working towards the betterment of the health for the mothers and the children. And this intensified Mission Indradhanush, we call it as IMI, it further intensified the immunization program, as I already showed you in the chart. And this also aims to achieve the sustainable development goal, where to end all the preventable death by the year for the children by the year 2030. And the world's largest COVID-19 vaccination program is under this IMI, and it aims in vaccinating the entire population against this COVID-19 pandemic. You all know about how successful is this COVID-19 vaccination program, and vaccination COVID-19 booster dose program also has been started, and the vaccination program for 15 to 18 years has started. And today you would have heard the news of where 12 to 14 years of children also this COVID-19 dose is started from today. So just to show you an example of this graph where COVID vaccination statistics and the success, you can see at least 1 dose, 70.2% of the population have covered with at least 1 dose, and around 60% being fully vaccinated. You can see around even you can go to the statistics data and you can see the region wise of how far this entire vaccination, COVID vaccination has been covered and successful. Yeah. So knowing all the importance of this vaccine and the various vaccination program that is going on in our nation, what I feel on this National Vaccination Day is that we all should appreciate and quantify the health, the economic and social benefits of these vaccines and immunization programs to the individuals and the society and to the entire population, and the personnel who are related to the health and paramedical services who are viewing this particular webinar should take responsible in creating the positivity and the awareness and the ongoing vaccination drive, and should support the population and also support the entire health team to achieve successful vaccination for the entire population and work towards the development of the health of our particular nation. And the webinar, we have taken references from some of the articles and even World Health Organization's basics on immunization and vaccination, and some of the lessons that were learned from intensified Mission Indradhanush, which was across sectoral system strengthening strategy. Okay, and that's about today's webinar, and thank you and wishing you all a happy National Vaccination Day, and request all to take a commitment to create awareness in whichever community or the public health you are serving for. Thank you. Thanks a lot.
Thank you so much, Dinesh sir, for this wonderful session. I believe everyone gained knowledge about National Vaccination Day and its significance through the session. On behalf of IFERP and SFNP, I would like to extend my gratitude to esteemed speaker Dr. Dinesh Selvam for delivering the keynote address. Thank you, sir, once again. I would also take this opportunity to announce our upcoming conferences, Convergence 2022, which is going to happen on 14th and 15th of May 22 at Vinayagar Mission University, Faculty of Allied Health Sciences, Salem, Tamil Nadu. Fourth International Conference on Nursing Science and Healthcare, which is going to be happening on 27th and 28th of August 2022 at Malaysia. For more details, always feel free to reach us. Thank you. Have a great evening ahead. Thank you.
Thank you.